my amazing co-host, Fizzy. Hi, guys.
Hi, Layne.
Hi, how are you?
Very good. Dr. Nanos, do you want to tell everybody about yourself real quick before we begin?
Sure. I'm a family physician practicing in Encinitas, California. I have a concierge medical practice, and I also do telemedicine, and I also have a advanced training in epidemiology, which is the study of how diseases are spread. So I've been helping to educate the public a lot about COVID-19 since the pandemic started.
Excellent. So let's get right into this. Last time you were on the show, we basically talked about anything and everything but COVID-19. So this week we are coming back with a vengeance, and we're going to be talking about everything and anything COVID-19. And I know that Fizzy had a few questions. This all came up last week. He and I had a long phone conversation, and he started asking this plethora of questions, and I was like, you need to stop right now and let's get Dr. Nanos on the show again so you can ask her all of these specific questions. So
yeah, for sure, absolutely. I think the big one right now that is, everyone's talking about is, should people be afraid to go to the doctor? I'm reading articles about people not going to the doctor for basic things, checkups and so on and so forth, and then it's even going into things like biopsies that aren't getting done, procedures that aren't getting done, which ultimately could lead to further complications and potentially death. So what are your thoughts on that?
Yeah, you're exactly right. That is a big problem right now. And probably your doctor's office might be the safest place to go right now. They, a lot of primary, going to your primary care office is not the same as going to the emergency room. You can also do a lot of visits through telemedicine, and we can accomplish a lot of care through telemedicine as well. So definitely reach out to any of your doctors. All of our patient visits are down by a significant volume, like half to like 70%. So your doctors are available and there for you. And so I think it's important to remember that even though it may seem like routine care, if you're not taking care of it in a routine way, it then becomes an urgent and potentially life-threatening matter. So, those biopsies, any issue that you feel you would normally see your doctor for, you should definitely email. Email is usually the best these days, but you can also call your doctor's office, and ask how they would recommend that you be seen. Whether some things do warrant an in-person visit, but you'd be surprised. I'd say about 70 to 80% of what we treat can be done through a telemedicine visit very effectively. That will put both you and your family at ease. But definitely do not neglect going to the doctor right now.
In that same vein, do you think that this pandemic, and now that we're having doctors do more telemedicine, do you think this is going to start a process where telemedicine becomes the norm, or much more than we saw before?
I certainly hope so. It's something that all doctors have been wanting for a very long time, because it's a way to deliver more care, better care to a wider audience of people, even in developing countries. If we can do telemedicine into the underserved here in the United States, we can, most people have cell phones regardless of their income status. And if we can deliver care to them at the end of their cell phone, that's a game changer for health for a lot of people. So that is certainly my hope, and something that the medical community has wanted for a really long time. So this may be the silver lining of COVID-19, is that we can see better access to care delivered to more people via telemedicine. It would be great.
Yeah. I mean, there's always been that, I'd say joke, but people that would go on WebMD and be like, oh my God, I have this disease or that disease. And, do you think, in other words, should people get away from that and just utilize the phone for their doctor visit, as opposed to like Googling things, and because that can always be a problem, right? When people go on WebMD, I have toe cancer. It's like,
yeah, no, the second you go on any kind of Google search, you think you have the worst thing possible. And I don't think we're ever going to stop people from doing that. But certainly knowing that in that same instance that you're Googling something, you can also find an app or a website to find a reliable doctor on the other end, a trustworthy physician or a physician's assistant or nurse practitioner, someone that can answer that question for you in real time that's pertinent to your individual situation. That would be the ideal thing.
Great. I want to talk a little bit about this, the antibodies test.
Sure.
So it's all the news. Everyone's talking about it, going out and getting a test to find out if you're exposed. And they're discovering that so many more people were exposed to this and didn't have any symptoms, which the word I think you're using is it passport?
So yeah, the antibody tests are a little bit complicated, and yes, so the immunity passport, I can explain that as well. So just to kind of give everyone an overview on testing, because it is a little bit of a nuanced subject area. So the test, the nose and throat swab tests that we've had for a long time, for the last 2 months, those just look and see, they detect the virus in your body. And then these antibody tests, and those you send out to the lab, they take several days to come back. And they just give you one picture, snapshot in time. Do you have the virus like at the moment you were tested? So the other test that we're talking about is an antibody test, and that's a blood test. And there's 2 ways to get that blood test. You can get it at a lab where they like draw your blood as they normally would, like from an arm vein, and they put it in a tube and they send it out and it comes back in a day or 2. And that's great, but that's still a little bit of a lag. What would be ideal and what everyone really wants to have as a reliable test is the 15-minute finger stick turnaround test, antibody turnaround test. And so what has happened, unfortunately, about 6 weeks ago, the FDA did a fast track authorization, FDA fast track approval to allow a lot of companies to put experimental tests that are 15-minute finger sticks out on the market. Well, they did that too quickly without any scientific oversight. And so now what has happened is there are hundreds of thousands of these finger stick tests that are on the market, and we have no way, I mean, no way of knowing which ones are good and which ones are not reliable at all. They all look identical. I've seen them. It's really crazy. So what we're waiting for is some of the bigger lab companies that are doing rigorous scientific trials to determine better validity and accuracy of those quick finger stick tests like LabCorp and Quest, and that have the resources to do that. So when they can put those kinds of tests out on the market, then we can have more reliable data. So, I mean, if we have lots of antibody tests and they're totally unreliable, then that's useless, and that kind of can be dangerous.
So in interim, you think like right now, if someone was really wanting to get this test done, do you recommend them going to get it where they draw the blood? Is that the preferred way to go?
Those are ideal. So Quest and LabCorp, those are the 2 biggest lab testing companies in the United States. They both have that test available in their labs right now, but I believe you need a doctor's order for it. And at least as of like yesterday, it could have changed today. You need a doctor's order for it, and you have to go into the lab. So what I've been telling my patients, because a lot of them are asking, there is also the risk of exposing yourself by going to a lab where there may be potentially sick people, and how important is it for you to know? So I think there's certain circumstances where it is important for you to know. If you're actively caring for someone with COVID-19, or you're a healthcare worker who's actively potentially looking at people with COVID-19, then it's important for those people to know. But it's an individual judgment call, I think, after that.
Hey, Dr. Nanos, so there's been quite a few of these like rapid testing sites that have been shut down. Can you tell us why that's happening? You think during this time that we're getting more tests, that these types of places would be ramping up and not closing down? What's going on with that?
It's exactly for the reasons that we just talked about, because the reliability of the test can't be guaranteed. And so, and people are charging an arm and a leg for them, like, $150 for what could be a totally fake test, and they don't have the license to do it. They're just, it's the Wild West. And so, and it gives people a false sense of security if they're getting a test back that, may or may not be accurate.
Yeah, false negatives can definitely cause more problems.
Right.
Or false positives.
And false positives for immunity, that's the thing. And we don't know how long immunity lasts, which is kind of along the lines of what you wanted to talk about, Fizzy.
Yeah, well, the CDC comes out and says, look, there's no way to know that you have immunity, even though you have the antibodies. That's probably related to what, like how much of the virus you're exposed to. In other words, how much antibodies your body produced because of the amount of virus you touched, or how does, and then why would you have in the past? I'm sorry, but in the past, coronavirus, the antibodies have always given immunity. So why wouldn't it on this one? Those are some of the questions that people have.
Yeah, absolutely. I can answer all of those questions. So COVID-19 is a novel strain of coronavirus. So this is totally new and we haven't seen it before. Even though it's in the same family, it behaves very differently than other coronaviruses. Typically, the coronaviruses we've always known have produced very mild disease. The coronavirus, as we all learned in medical school, causes the common cold. COVID-19 is a very different situation, so it behaves differently. In terms of antibody testing, there's two kinds of antibodies so an antibody is your body's natural immune response to fighting infection. And you form an IgM antibody first, and those are the biggest antibodies, and that's when you're actively fighting a disease. So these finger sticks actually give you two antibody results, IgG and IgM. IgM tells you if you're infected in that moment. And then the IgG takes a few, well, we don't exactly know how long, but sometimes it can take at least 2 weeks, sometimes 4, to develop the IgG antibodies, and those take longer to develop. And that tells us if you've been exposed to the virus, if you've been vaccinated. So, that's a different story because we don't have a vaccine. But in general, that's what IgG antibodies do. They tell us if your body has ever seen this virus before. And so, to your point, a lot of people are out there who are asymptomatic or had no symptoms at all, and still had the virus, or may had like something very mild that they didn't realize was COVID-19. And so we want to have that information, but we just need the reliable tests to get it, and we just unfortunately don't know. Because we don't have enough data, we don't have enough information to say, okay, this confers X amount of immunity for this long. It's just not enough data to make a sound judgment call on it.
There's been some talk about, and there's some doctors that have come out and said that it's probably beneficial to be exposed to viruses and bacteria because that keeps the immune system actually more active and strong. Is there any truth to that? In other words, I guess my question is, the social distancing that we're going to see in place now for a long time, could that ultimately work against us in the fact that the same way if you don't go to the gym, your muscles get weaker?
Yeah, that was the question, right? So are we hurting our immune system just in general by not going out and getting exposed to bacteria and viruses and things like that we would normally be exposed to, that now we're social distancing and we're not exposed to anything? Is this causing problems?
I think in the short term, it's probably not going to do a lot of harm to our bodies. I think in the long term, it's something to definitely consider. But my hope is that, as again, this kind of gets back to getting more testing out there so that we can make really good choices for each community based on the level of exposure and risk for, say Encinitas versus like all of California or, the entire United States. I do think if we had more information, it would be better to make better informed decisions about social distancing based on what exactly is happening in your community rather than like a blanket order for the whole country or the whole state. And ultimately having that data with testing and contact tracing will help us kind of narrow it down so that only those people that really need to be socially distanced and isolated and people who are sick are the ones that are going through that. And so I'm hoping we're going to get away from that as time goes on and we have more data with testing.
Dr. Fauci said that we might see the end of shaking hands and things like that. We're never going to return to normal. Is that alarmist? Is that too much? Is that going too far with this whole thing, or do you think that's?
No, I would love to never shake anyone's hand again. Yeah. I gotta tell you, I love hugging people.
Doctor, I have to ask you, are you a germaphobe?
No, I'm not a germaphobe, but I always think it's like the grossest practice because I don't know, I'm like super thrilled to never shake anyone's hands again. And I'm pretty sure most doctors would feel the same because it's like the easiest way to transmit infection.
Now, is it shaking the hands, or is it from shaking hands and then touching the face? In other words, if you take touching the face out of the equation, then just shaking hands, are you going to get any diseases if you take?
That's a good question.
Well, then you're going to touch something else that someone else might touch, or you can. No, like my immediate instinct is every time I shake someone's hand, I'm just like, where's this? I need to wash my hands like all the time.
What if I play devil's advocate right now and say, yeah, I need that to expose my immune system to keep everything, vibrant and strong to fight off whatever. I mean, what do you say? I'm playing devil's advocate. What do you say to those people that say, yeah, the more viruses and bacteria I touch, the stronger my immune system becomes?
I think, no, I think you'll still be fine if you don't shake someone's hand. I disagree with that. Yeah. I'm like, I can't wait to get away from handshaking. We can do like the tie do like a bow, or it can go, there's lots of ways to like acknowledge people. I can't wait. I'm gonna come up with some new ones too.
The fist pump. Is that,
Yeah.
are you with that?
That's better than an open hand. Yeah.
I mean, I know we're
I'll do an elbow bump.
Yeah.
Can you really do an elbow bump on a professional setting if you're going to be making a brokering a deal? I mean,
I've done it. Yeah, I'm all for it. I'm totally serious.
So there is some information about vitamin D with the immune system.
Yeah.
So now they're telling us stay inside, but then now there's people saying, no, I'm a red-blooded American. I'm going out and I'm going to go outside. Their argument is vitamin D, right? Maybe that's an argument. So how do you weigh that? How do you weigh against that?
Well, we live in California. You can still go outside. No one's telling people not to go outside. You can go out. You just can't be. So it doesn't make sense to me.
So you're saying go outside, get the fresh air, get the vitamin D.
Yeah, absolutely.
I think that goes along with the question of like the vitamin D as a vitamin or in the sun, and then garlic was brought up as something that kills the virus.
No.
Right. I think that's what Fizzy's getting at here.
Yeah, that's a hard no.
So obviously, if anyone's been watching the news, they saw this whole conversation about, and I know the disinfecting question, but I'm going to focus more because there's more evidence for this. The UV light. Can I talk to you about the UV light?
You can talk about it, sure.
Yeah. So the president did get in trouble for the UV light comment. However, it looks like there's a company and there's other companies that have been using UV light. Now, I know they've used UV light in the past to disinfect things, like buses have been exposed to UV light for disinfectant. Clean rooms have used UV light in the past. However, there's a company that it looks like, and there's other companies working on this technology as well, the light actually would go down through an esophageal tube and do some things. Do you think do you think that's something that you see could happen? Is that futuristic medicine?
You know what? I'm a very open-minded person. I think you just need more science, you just need more data. We just need more data. So far, there hasn't been any data to support that as a viable alternative treatment. But again, show me the data, show me the science, and that's what we need more of.
Show me the money.
Within that same realm, that question, leaving your masks or your PPE equipment outside in the sun, does that have any effect on killing the virus? Is that true?
No, other than just over time, the virus will die eventually. I don't think it makes a very huge difference. I think your best bet is to, again, wash your hands. That's probably the most important thing. Wash your face after you've had your mask on, and use a new mask every day, or if you're in the healthcare setting, or use a cloth mask that you can wash daily. That's really the simplest and easiest way to wear your mask properly, so that you don't end up reinfecting yourself or infecting yourself inadvertently.
Can people spray the mask with like alcohol or peroxide to disinfect it? If, let's say, somebody doesn't have access, because they're really hard to get sometimes, the masks. Like, they're sold out on Amazon. You can't get them. They're expensive. There's been some price gouging going on. I don't know. I mean, can you disinfect it with alcohol?
So I would recommend, when I go out in public, even though I have access to masks, I don't waste my masks, my medical masks in public. I use a cloth bandana. So I don't recommend that anybody use, my opinion is you can just use a regular cloth and not use masks, and really save those for healthcare workers, because they're in very, very short supply. It's extremely hard for us to get them, and they are 10 times more than they used to cost. So
yeah, are you guys still in that predicament now? It hasn't slowed down at all?
Absolutely. In fact, we were on the phone with our medical supplier this morning begging for masks. begging.
Wow. Wow.
So you will never see me wear a medical mask in public.
I mean, there is some conversation about another silver lining to this whole pandemic, and that being production of antibiotics and PPEs and so on and so forth made in the United States, as opposed to overseas, where there's a vulnerability factor, right? So is that something that you've heard about? Is that another thing you think will be a good result from all this?
That would be great. I mean, over the last decade and decade plus, we've seen a lot of quality issues with generic medications for a lot of medications coming out of China and other countries where quality has been a major concern, and we've had massive nationwide recalls on a lot of those medications, particularly for blood pressure. We've seen quite a few, and especially over the last like 3 or 4 years. So it would be great to have better quality, no matter where it comes from.
Yeah. And I think is it correct to say 97% of the United States' antibiotics are made overseas? Is that correct?
I don't know the exact number on that.
Yeah, I read different numbers, but it's probably somewhere over 90%.
I wouldn't be surprised, but I really don't know the number.
Yeah, and that does put us in a vulnerable spot. I mean, if there's ever a situation where, like we're seeing now, so that's another.
Right, but keep in mind, antibiotics do not treat COVID-19. They only treat viruses. So antibiotic production doesn't impact COVID-19 right now, other than the fact that people who may need medication may not have access to doctors, but antibiotics don't treat the virus.
Can we go back to the antibody testing again and just ask should everybody be getting tested? Should we all be running out, calling our doctors, making appointments? I know you were saying that some of the minute type drive-up labs have shut down. Do we wait for? I know that they want to do certain. They sent over, what was it, 1.5 million testing kits or something?
For Abbott, yeah, that's for Abbott. Correct. Gavin, Newsom ordered 1.5 million from Abbott. Correct.
Yeah, and Abbott, I understand, is coming out with or already has a more reliable product out there, but they're just not in wide distribution, and they're also gouging the prices. So you want to, if you're going to test everyone, you want to make sure it's at an affordable price point for everybody to be tested, not where you have to pay $150, $200 out of pocket just to be tested. So ideally, to answer your question, Layne, yes, every single person should be tested, but it's not possible right now. So I think, sorry, go ahead, Fizzy.
Please continue. I'm sorry, go ahead.
No, I was just going to say, I think the priority of people who should be tested right now are people who are actively caring for COVID-19 patients. Like if you have a loved one at home who has COVID-19, it would obviously be very helpful to know if you've already been exposed or who in your family has been exposed that can probably be better suited to take care of that individual in the house. And then for healthcare workers. And then after that, once we get more testing, absolutely everybody should get tested.
Do you think that it's fair to say that if we did testing within certain areas, so a highly populated area in San Diego or a highly populated area in Los Angeles or San Francisco, that they could really determine how many cases there are and possibly how many cases there would be, instead of diverting, 6, 8, 10 million tests? And then you have to have the humans to be able to administer those tests and then be able to go through the process. Does it make sense to identify the hot areas without having to test everybody, or just make an assumption that everybody in, the Haight in San Francisco is probably either been exposed to or has coronavirus or COVID-19, sorry.
Well, you would think, yes, but then these hotspots turn up in places like you wouldn't expect. So, I mean, obviously New York is a special situation. It's a highly densely populated area. But I mean, you look at right outside of New York, like quiet suburb of New Rochelle, they had a huge outbreak early on. And that's like Encinitas. It's a suburb where you wouldn't necessarily say, okay, let's test everyone here. So, it's a hard call to make. to allocate who gets tested and who doesn't. But my hope is that in the coming weeks, that more of these tests will be available so that it isn't an issue, and that will kind of get the ball rolling for, you know, getting more data out there that's reliable that we can make better decisions on.
There was a conversation about COVID-19 living on mail, and there was people microwaving their mail. Is it crazy talk? What? I'm dead serious.
Thank God we can't fit in the microwave, because that would be, we would be
I mean, that would, you'd probably set your mail on fire, I would think. Someone asked me about microwaving cash. I'm like, really? But yeah, no, I would just say, if you're that worried, put some gloves on, open the mail, you know, throw out the envelopes, wash your hands, and call it a day. Like, you know, there's a level of taking it too far where you're creating a lot of unnecessary anxiety for yourself, which I think is also another issue that we're looking at a lot. We're seeing a big uptick in anxiety and depression. And so we want to limit that as much as possible for people.
Yeah, right. And that goes in connection with liquor stores being considered essential.
Yes. So there's been a huge rise in addiction and relapse, and, you know, alcoholism, drug abuse, and domestic violence. So these are a lot of the fallouts from this prolonged isolation for people, which is a huge problem with major ramifications on our health and our society down the road.
I mean, it's going to be difficult for people that maybe, it's just a challenge for people who are recovering. And so how do they stay away from that, you know?
This tests them in every way, and it's really tough because you know, I know AA and NA still have meetings online, so I encourage anyone who is part of those programs or wants to join them can do those meetings online. I know a lot of patients who are doing that still and should. And then a lot of therapists are also providing mental health support online, and psychiatrists and primary care doctors. We do a lot of mental health treatment as well. So there is, and that's certainly one of the easiest things that we can take care of via telemedicine. So if you are depressed, if you are anxious, if you're struggling, please reach out to your therapist, your family doctor. We are here for you, and that's really critical.
All right, doctor, we got a minute on the clock here. We know we talk about addictions when it comes to alcohol and substances, but what about food? We're seeing a lot of things on Instagram and so on and so forth. People are cooking all kinds of food. They're eating, I don't know, hot Cheetos for breakfast, and it's just getting crazy. So before we go, do you have any suggestions for people maybe who are finding themselves eating too much of the wrong food?
Yeah, I hear you loud and clear on that one. I would say, you know what? There's an abundance of fresh food still in the grocery stores. So rather than going to all the processed and canned foods, buy some fresh fruits and vegetables, make soups, make other healthy vegetables or healthy foods that you can freeze potentially and have down the road, and really focus on taking good care of yourself and eating well. And that's the best thing you can do for your immunity.
Thank you so much. It was a pleasure to meet with you, doctor. Thank you for your time.
Thank you. It was fun.
Thank you, Dr. Nanos. We'll talk to you again soon.
Thanks, Layne.
Okay. Guys, that was Dr. Nanos from Kind Health Group in Encinitas, California, family practitioner and trained epidemiologist.
Trained in epidemiology.
Great. Thank you so much, guys. We'll see you again next week, maybe.
Thanks, Layne.
Okay. Bye.